Hi friends, good afternoon. I'm Dr. Sudip Chowdhury. I'm a senior pediatric consultant at Columbia Asia Hospital and also at medical clinics in Gurugram. Today I'm going to speak to you about something very important and very interesting. As you all know that we are sitting on this huge second wave of coronavirus, and as suggested by many sources, we can go up to the third wave, which would mainly involve kids because they are the ones who probably would not be vaccinated by that time. Now this is pretty serious because all of us don't want our kids to be within this coronavirus pandemic. That's the last thing what we want as parents and caregivers. Now this video is mainly directed towards parents just to help them alleviate some concerns regarding home treatment for coronavirus. Even in the second wave, as we can see that many children are getting involved or infected with COVID-19, but thankfully majority of them are showing only mild symptoms. Now in mild symptoms we always talk about home isolation and home treatment. Now what is all these things about? And we have earlier talked in our previous videos about mild, moderate and severe forms of coronavirus infection and how to treat them as and how they proceed. Today we're just going to focus our discussion on home isolation and what exactly do we mean by home isolation, how do we actually treat children with coronavirus at home. Now majority of them, as I said, can be treated at home if they have mild symptoms. The main symptoms of coronavirus are fever, along with cough, cold, headache. They can come with diarrhea and vomiting, or they may come with massive body aches and feeling of very tiredness and fatigue. Now having said that, once we have done an RT-PCR test, we know that there's definitely a COVID-19 infection. We can start the treatment accordingly. Now the most important cornerstone of treatment for coronavirus in kids is rest and home isolation. By rest we mean that we would ask them to reduce their daily activities to a bare minimum. Let them sleep, let them eat, drink, be merry, watch television. Don't stop them this time. Don't stop them from watching screen, because that's the only way they can actually vent out their unspent energies. Next is give a lot of fluids, because whenever you have high temperature you need a lot of fluids in your body. So give them a lot to drink. They can have lassi, they can have charge, they can have fruit juices, obviously homemade. Don't use those packet juices. They have a lot of preservatives in them. Give them coconut water, fresh coconut water, a lot of ice water if it's very hot around. You can monitor some signs, like especially like heart rate. You can monitor the saturations every 4 to 6 hours. Is very important. You can monitor the breathing rate. It's very important because, as I told you in the previous videos, that depending on the rate of breathing, we can classify infection as mild and moderate. So if they are fast breathing, they become a moderate form of COVID-19. And also, if your child is diabetic, don't forget to measure their blood sugars. Most importantly is ask your pediatrician if there's any concern. Talk to them regarding the medications we use. We are using some antibiotics at times, especially to prevent secondary pneumonias. And otherwise, we are giving them some vitamin C, some vitamin D, because there's evidence that a child who has a good store of vitamin D doesn't develop complex symptoms of COVID-19. So I think this is in a nutshell how we do it in practice at home isolation. But then again, if you have any questions or concerns, don't forget to come back to us. We'll be more than happy to help you out with your questions and answers. This is again Dr. Sudip Chowdhury signing off. Thank you very much for listening.